Hello, I'm Jennifer O'Connor, a registered nurse and clinical educator for Baxter Healthcare Corporation. In this video, I'll be covering an important aspect of extraneal training focused on the risk of unrecognized hypoglycemia involved in some blood glucose monitoring devices and test strips. This training is an integral requirement for Baxter's Risk Evaluation Mitigation Strategy, REMS, agreement with the FDA. Today we will be covering the demonstration kit that was sent to your clinic and review the nurse training tool, patient training tool, and briefly review the medication guide. The first thing I will cover is our clinic demonstration kit, which you should have received prior to this training. If you have not received a kit, please contact your Baxter clinical educator or portfolio manager so we can provide you with a kit. The kit has various components: PD nurse training tool, patient training tool, various extraneal warning letters, wallet card, warning sticker, hang tag, and wearables including a necklace and bracelet. The kit also includes the extraneal medication guide and full prescribing information. Let's review each component. Let's start with the nurse training tool. Page 3 and 4 of the nurse training tool show the indications and important risk information for extraneal. Indications: extraneal icodextrin is indicated for a single daily exchange for the long 8 to 16 hour dwell during continuous ambulatory peritoneal dialysis or automated peritoneal dialysis for the management of end-stage renal disease. Extraneal is also indicated to improve, compared to 4.25% glucose, long dwell ultrafiltration and clearance of creatinine and urea nitrogen in patients with high average or greater transport characteristics as defined using the peritoneal equilibration test, PET. Warning: unrecognized hypoglycemia resulting from drug-device interaction. Only use glucose-specific monitors and test strips to measure blood glucose levels in patients using extraneal icodextrin peritoneal dialysis solution. Blood glucose monitoring devices using GDH-PQQ or GDO-based methods must not be used. In addition, some blood glucose monitoring systems using GDH-FAD-based methods must not be used. Use of GDH-PQQ, GDO, and GDH-FAD-based glucose monitors and test strips has resulted in falsely elevated glucose readings due to the presence of maltose. Falsely elevated glucose readings have led patients or healthcare providers to withhold treatment of hypoglycemia or to administer insulin inappropriately. Both of these situations have resulted in unrecognized hypoglycemia, which has led to loss of consciousness, coma, permanent neurological damage, and death. Plasma levels of extraneal icodextrin and its metabolites return to baseline within approximately 14 days following cessation of extraneal icodextrin administration. Therefore, falsely elevated glucose levels may be measured up to 2 weeks following cessation of extraneal icodextrin therapy when GDH-PQQ, GDO, and GDH-FAD-based blood glucose monitors and test strips are used. To avoid improper insulin administration, educate all patients to alert healthcare providers of this interaction, particularly in hospital settings. The manufacturers of the monitor and test strips should be contacted to determine if icodextrin or maltose causes interference or falsely elevated glucose readings. For a list of toll-free numbers for glucose monitor and test strip manufacturers, please contact the Baxter Renal Clinical Helpline, 1-888-RENAL-HELP, or visit www.glucosesafety.com. Because of the risk of unrecognized hypoglycemia that could result from a drug-device interaction, extraneal is available only through a restricted program. Extraneal icodextrin is contraindicated in patients with a known allergy to cornstarch or icodextrin, in patients with maltose or isomaltose intolerance, in patients with glycogen storage disease, and in patients with pre-existing severe lactic acidosis. Extraneal is intended for intraperitoneal administration only, not for intravenous injection. Aseptic technique should be used throughout the peritoneal dialysis procedure. Encapsulating peritoneal sclerosis, EPS, sometimes fatal, is a complication of peritoneal dialysis therapy and has been reported in patients using extraneal. Serious hypersensitivity reactions to extraneal have been reported, such as toxic epidermal necrolysis, angioedema, serum sickness, erythema multiforme, and vasculitis. Anaphylactic or anaphylactoid reactions may occur. If a serious reaction is suspected, discontinue extraneal immediately and institute appropriate therapeutic countermeasures. Effective use of extraneal may be compromised in patients with abdominal conditions predisposing them to complications of peritoneal dialysis, including infection. Overinfusion of peritoneal dialysis solution volume into the peritoneal cavity may be characterized by abdominal distension, feeling of fullness, and/or shortness of breath. Drain the peritoneal dialysis solution from the peritoneal cavity to treat overinfusion. Patients with insulin-dependent diabetes may require modification of insulin dosage following initiation of treatment with extraneal. Monitor blood glucose and adjust insulin if needed. Peritoneal dialysis may affect a patient's protein, water-soluble vitamin, potassium, sodium, chloride, bicarbonate, and magnesium levels and volume status. Monitor electrolytes and blood chemistry periodically. Monitor fluid status to avoid hyper or hypovolemia and potentially severe consequences, including congestive heart failure, volume depletion, and hypovolemic shock. Abnormalities in any of these parameters should be treated promptly under the care of a physician. In clinical trials, the most frequently reported adverse events occurring in less than 10% of the patients and more common in extraneal PD solution patients than in control patients were peritonitis, upper respiratory infection, hypertension, and rash. The most common treated related adverse event for extraneal PD solution patients was skin rash. What are the potential risks with extraneal PD solution use and glucose monitors and test strips? Use of extraneal PD solution results in elevated blood glucose levels of maltose, a metabolite of icodextrin. Maltose interferes with glucose monitors that utilize certain enzymes on their test strips, resulting in falsely elevated blood glucose monitor readings, specifically GDH-PQQ, GDO, and in some cases GDH-FAD. The interference may mask true hypoglycemia or lead to the erroneous diagnosis of hyperglycemia. Glucose monitors that use GDH-PQQ, GDO, and in some cases GDH-FAD must not be used for patients using extraneal PD solution. What concerns might the patient have if someone checks their blood glucose levels? Extraneal PD solution can cause falsely elevated blood glucose readings for up to 14 days after its last use, regardless of the patient's diabetic status. Extraneal PD solution or its byproducts, such as maltose, can cause some types of glucose monitors and/or test strips, including devices used at hospitals, clinics, and by emergency medical personnel, to give a falsely elevated blood glucose reading. Only blood glucose values processed at a hospital's central laboratory should be used. What are the risks associated with having a falsely elevated blood glucose reading? Situation A. A falsely elevated blood glucose reading may lead to the erroneous diagnosis of hyperglycemia. Potential risk. A falsely elevated blood glucose reading could cause you or another clinician to administer insulin to the PD patient that is not needed. Situation B. A falsely elevated blood glucose level may mask true hypoglycemia. Potential risk. A falsely elevated blood glucose reading could cause you or another clinician to assume that a PD patient's blood glucose level is normal when their true hospital center lab blood glucose level may be dangerously low, causing the patient to subsequently enter a hypoglycemic state if the appropriate steps are not taken to bring their blood glucose level back into normal range. Both of these situations can result in unrecognized hypoglycemia and may lead to the following life-threatening events or reactions: loss of consciousness, coma, permanent neurological problems, death. Recommendations for patient training regarding glucose monitors and test strips include: train all patients and caregivers on the importance of using only glucose-specific monitors and test strips and about the potential life-threatening consequences if these guidelines are not followed. Instruct them to ensure that any emergency contact also be aware of this information. Reinforce the need for all patients to alert healthcare providers outside the dialysis units, emergency room, hospital outpatient clinic, physician offices, of the potential risk of incorrect blood glucose monitor readings. Use the Extraneal Icodextrin PD Solution Patient Training Tool and Extraneal PD Solution Patient Medication Guide to educate all patients about glucose monitor and test strip interference. Assist patients in completing the information on the wallet card included in the Extraneal PD Solution Training Tool. Your PD unit has received a demonstration kit which contains a sample of all the items included in the Extraneal PD Solution Patient Kit. Prior to initiating therapy with Extraneal PD Solution, review the contents of the kit with patients and inform them that an Extraneal PD Solution Patient Kit will be delivered to their home shortly. Additional considerations when training diabetic patients using Extraneal PD Solution: verify the type of glucose monitor and test strips used by the patient. Call or instruct the patient to call the manufacturers to verify that the monitor and/or test strips measure only glucose. Monitors and test strips that are subject to maltose interference must not be used. Remind patients to take their patient kit with them to all medical appointments, including visits to the emergency room or hospital. If hypoglycemia is suspected, do not delay treatment, since severe hypoglycemia may lead to life-threatening consequences, including loss of consciousness, coma, permanent neurological problems, and death. Confirm blood glucose readings using a laboratory-based method whenever available. If you are unsure of the method used by a specific glucose monitoring system, please contact the manufacturer to determine if the test strips are glucose specific. On page 2 of the Nurse Training Tool, a list provides the names and contact information for manufacturers of today's most commonly used glucose monitors and test strips. It is included for reference only. You need to contact the manufacturer to ensure that the monitor and test strips use a method that does not cause maltose interference with test results. This list does not indicate that Baxter is recommending these products. For further information, visit www.glucosesafety.com. The bottom of page 2 of the Nurse Training Tool contains information to help protect your patients. If your patients are Medical Alert members or members of another Medical Alert service, be sure to encourage them to update their medical information. Medical Alert can be reached at 1-888-633-4298 or at www.medicalert.org. If your patients are not members of a Medical Alert service, encourage them to wear the Extraneal PD Solution necklace or bracelet provided by Baxter in the Extraneal PD Solution Patient Kit. This could help to save their lives. If you need additional training materials, including Extraneal PD Solution demonstration kits, patient training tools, and guide for the PD nurse free of charge, please contact your Baxter Clinical Educator or your portfolio manager at 1-888-736-2543. If any of your patients need a replacement of the Extraneal PD Solution patient kit, please have them contact Home Care Services at 1-800-284-4060. Also included in the demonstration kit is an Extraneal patient letter that includes important information that the patient can provide to someone outside of the dialysis clinic. In addition to the patient letter, there are also letters for the hospital pharmacy, nurse, administration staff, laboratory services, and physician. These letters warn for potential incorrect blood glucose readings. The letter also includes a suggestion that the electronic medical record include information that the potential for interference with blood glucose monitors and test strips should be entered in a prominent field. Included in the demonstration kit is a warning label to be placed on the patient's chart, a hang tag that should go where the patient goes and placed on the IV pole or patient's bed rail, a wallet card, keychain, and 2 different wearables. The patient may either wear a necklace or bracelet that warns of the drug-device interaction with extraneal PD solution. Also included in the kit is full prescribing information for extraneal solution as well as a medication guide. When you order extraneal for your patient, a kit will be shipped to the patient's house. This kit includes patient training tool, warning letters, warning label, hang tag, wallet card keychain, necklace and bracelet, full prescribing information, medication guide. To assist in patient training, Baxter has developed a patient training tool that contains important risk information about extraneal PD solution. Please discuss the tool in detail with your extraneal patient. On page 2 and 3 of the patient training tool, please review the example high-risk scenarios where non-glucose specific monitors and test strips may be used. Remind your patients whenever they receive medical care, whether it's a scheduled appointment, an outpatient procedure, or an emergency room visit. Tell doctors and nurses that they are using Extraneal icodextrin PD solution. Some glucose monitors and test strips may give a false high blood glucose reading due to your use of Extraneal PD solution. Blood glucose levels should be tested at a hospital's central laboratory or with a compatible glucometer and test strips. Remind patients to bring their Extraneal PD solution patient kit along with them and give it to the doctor or nurse they are receiving treatment from. Also remind patients to discuss this important information about glucose monitors with their family and friends. In an emergency, they will be able to make sure the nurse or doctor knows of the potential for false high blood glucose readings. In addition, inform patients to show their wallet card to alert clinicians about the potential for incorrect blood glucose measurements. A wallet card is included in the patient kit. Please take a moment to fill out the wallet card with your patient during training. Page 6 reviews all of the materials included in the Extraneal patient kit. Encourage your patient to bring in their kits so that you can review it together. You may also use the demonstration kit provided to you. The bottom of page 6 of the patient training tool contains information to help protect your patients. If your patients are Medical Alert members or members of another Medical Alert service, be sure to encourage them to update their medical information. Medical Alert can be reached at 1-888-633-4298 or at www.medicalert.org. If your patients are not members of a Medical Alert service, encourage them to wear the Extraneal PD solution necklace or bracelet provided by Baxter in the Extraneal PD solution patient kit. This could help to save their lives. Remind patients to bring the patient kit with them whenever they receive medical care. If patients need a replacement kit, please have them call Home Care Services at 1-800-284-4060. On the last page of the patient training tool, a list provides the names and contact information for manufacturers of today's most commonly used glucose monitors and test strips. It is included for reference only. You need to contact the manufacturer to ensure that the monitor and test strips use a method that does not cause maltose interference with test results. This list does not indicate that Baxter is recommending these products. For further information, visit www.glucosesafety.com. Included in the patient training tool and each case of Extraneal product is the medication guide. This guide has information that is crucial to educating your patient. Some highlights are: what is important about Extraneal that your patient should know? What is Extraneal? When Extraneal should not be used? How Extraneal should be used? Possible side effects of Extraneal, how to store Extraneal, and general information about Extraneal. Please take time to review this guide with your patient. During the training of drug-device interaction, we have covered the components of the Extraneal demonstration kit, Extraneal patient kit, nurse training tool, patient training tool, prescribing information, and medication guide. To avoid delays in Extraneal shipping to your patients, please call your Baxter Clinical Educator in order to document your Extraneal training. If you have any questions, please contact your Baxter Clinical Educator or the Renal Clinical Helpline at 1-888-736-2543, option number 1. Thank you for participating in this very important Extraneal safety training.